We thank you all for listening to my conversation. This is almost like my video diary, folks. I want to educate everyone. Whatever the knowledge I have, I want to give my knowledge to you all on regard to the healthcare. Because my personal goal is all of you to be successful in personalizing your healthcare. This is your asset, man. You need to take care of your asset like it's your own money. It's your own money. It is your own money. Because what I'm suggesting is it's called rainy day fund, so-called HSA, is for your own health. I'm sure you have listened to my previous talks before. I continue to talk about one. In the morning, I talk about how do we finance. Now I talk about personal issues in regard to the healthcare. This is what I do, healthcare. I've been a provider for healthcare for many years, folks. Today I'm going to bring you some controversial topic. You may be surprised with my conversation, because this is something which I do this on ongoing. I'm a urologist, folks. I've been in California, Apple Valley for last 40 years. Okay, let's focus on what I can teach you to be independent by yourself. Because nowadays healthcare is nothing but the knowledge. You have everything on your fingertips. You have everything on your mobile phone. You can ask a Google doctor, he'll give you the answers. You can ask Alexa, he'll give you the answer. He'll ask, Siri, he'll give you the answer regarding the healthcare. If you have a question, ask Siri, ask Alexa. Here I am. Today's topic is, without wasting any time, self-prostate exam. Yes, I'm not kidding. Self-prostate exam. We all know that they've been advocating self-breast exam for breast cancer. Folks, for men, this is the third leading cause of death. I am not ashamed to recommend you to do a self-prostate exam. Yes, without hesitation, because the healthcare is such, when you go to the providers, half of them, they don't even know how to do it, especially your family doctors, your family physician, general practitioners, they fail to do it. This is the number one screening test, folks. This is the number one screening exam for prostate cancer. This is the third killer after lung and colon. Prostate is the third cause of death, folks. This is what I do. This is what I'm trying to. Personal responsibility is very important, folks. This is not, a cockamamie thing. I am recommending you very strongly, because self-prostate exam, I do it on myself. Okay? I'm not ashamed to say that. I do it myself. I do the exam. It is very simple, folks. It's between life and death. A lot of people fail to acknowledge that, and a lot of even physicians need to be learning how to do a self exam. I'm talking about general practitioner, family practitioner. Some of the female doctors, they don't do rectal exams. Whatever the reason may be, I understand. But if you're a man, you should be able to do. There are reasons why you should do a self-rectal exam. I'll give you the reasons. There are number one, in addition to being third killer among men, if you have any change in urinary symptoms, any change after the age of 40, I recommend. If you have any change in urinary symptoms, if you're going to the bathroom too much, you're getting up too many times at night, and your flow is not the same, whatever the reason, your urinary pattern has not been the same. This self prostate exam is recommended for over 55, 55 and 60, but I wouldn't be hesitant in saying even after 50. But after the age of 40, if you have any change in urinary, because my youngest prostate cancer was 38-year-old male. He didn't make it, folks. He didn't make it. What I'm saying is, prostate exam, when your urinary symptoms change, for any reason you doubt that is something needs to be checked up, then you fail to go and see a doctor for whatever the reason. People are busy with their lifestyles. This is a simple test, folks. Now with COVID situation, everybody has gloves. Yes, everyone has gloves. They are wearing gloves when they go out, when they're wearing. I'm sure you have a lubricating jelly somewhere. If not, it's not a big, you can use a Vaseline. It's not a big deal. Lubricating jelly or Vaseline, whatever it is, which comes, Vaseline is nothing but a petroleum jelly. So what I'm saying is, you just need a glove and a jelly. All right, we are there so far. I'm sure you guys do showers every day. I'm pretty sure you should do showers. It is, we all take showers every day. I don't do it, I don't do often, only when I think that it is need to be necessary. Again, listen to me. This is not a sexual deviation or anything. This is a self breast exam, same thing, self prostate exam. If you are in the shower, raise your leg, put it on a stool, put it on something which you can raise it. Raise your leg, one leg, and just hold it to the bar, hold it to the wall, whatever. With your left hand, use it with the left hand. It is, again, with your left hand, apply some jelly. Apply some jelly. And insert a finger into the rectum. It's simple, folks. It is not a difficult thing. Everybody, 99% of the folks, I'm talking about over 90%, maybe some of them have physical limitations in doing certain things. Other than that, I'm talking about for a normal human being. You should be able to insert a finger in the rectum. You will feel just above the sphincter. You feel the prostate. It's you can check in the anatomy. It is basically a little boggy stuff. Normally, the firmness is like a tennis ball. Comparison, very good comparison. It's like a tennis ball. If it's smooth, it is firm, and all around feel the whole prostate, the base, the apex, feel everywhere. If it's firm and smooth everywhere in the prostate, you can feel the whole base of the prostate, folks, then you're fine. You pass the test. That's all it is. You pass the test of prostate is normal. It doesn't mean for some folks, they may have a small focus of cancer you can't feel, but majority of it, 95% of the time, you can feel your prostate and tell, is it normal or abnormal? Normally, people are sexually inactive, they're not active. Prostate is like a boggy. It is like a, because of the semen behind, there are sperm sacs. So it's boggy, it's backed up. So it's okay. It's okay. It's being boggy doesn't mean it's a bad thing. It is fine. There's perfectly fine. People have boggy prostate. That's okay too. That's normal too. Again, as long as you don't feel any bump. Yes. If you're feeling the bump, you would know it. If it's really little bump, it is not a normal contour. Anybody can tell, man. Anybody can tell. If there's an abnormal contour, if there's a tennis ball, you feel it. If there's a little bump, can't you feel it? Yes. I recommend this to all men, folks. You will save tons of money. I'm not kidding. One of the reasons people, they don't even, a lot of family physicians, practitioners, they don't do these rectals. They ended up with a urologist. And I'm telling you, you'll be spending $200-300 for no reason. For no reason. You can save that money. How about that? This is called personal responsibility, folks. This is the personal responsibility. I admire guys to take your health into your hands. And if you have any doubt, if you feel you're not sure, then have your doctor, have your GP recommend you a PSA blood test, which is a simple blood test, folks. If you have any doubt, have your family practitioner GP do a blood test as a second backup. That will rule out prostate cancer, folks. I'm not kidding. If you have any doubt, if you still continue to have urinary symptoms, but you fail to feel any bump, your PSAs are still okay, iffy, you're not sure, then you should go. If your urinary symptoms, yes, you need to get the advice from a specialist. That's where your specialist cost goes up. But otherwise, most of the things, screening can be done by you, by your family doctor, even telehealth. Nowadays, I'm not kidding. Nowadays, they have this portable ultrasounds. Guys, they have portable ultrasound. The same thing. If you have any doubt, this portable ultrasounds does tell you if it's a cyst or a bump. It will tell you. And you send the images to the. I'm telling you, there are out there. You can send an image. Somebody will come and say, hey, you need to go and have it screened because there's something is not right. Am I asking too much? Really? It is simple, folks. I never had anybody do a rectal exam on me. I refuse to have a rectal exam because I do it myself. I'm a urologist. I understand, I'm confident about myself. But you guys can do it too. If you have any doubt, then, it's worth going to. I don't want you to neglect your health. This is the beauty about personal health care, man. You have a rainy day fund. You don't want to use your rainy day fund. You want to keep piling up your rainy day fund for the future use, for unforeseen circumstances. You can keep accumulating wealth till, you can accumulate your wealth, which you're putting in the rainy day fund forever, man. You can give it to your kids and you can give it to your grandkids. This is yours. HSA is yours. Nobody can take it away. Only thing I'm asking these bureaucrats, representatives, come to their senses, do a public-private partnership, man. That's the least they can do instead of going through public option, one size fits all. We have seen it all in England and Canada. It just doesn't work. I'm telling you. It doesn't work. Singapore has the best model, believe it or not. America, after spending, they're wasting money, $3.8 trillion, which is almost like 17.8% of the GDP. They're wasting that money. We can invest in you, Americans. I want you to get it. Even the Medicare, they should be stopped pumping into these intermediaries, man. They're wasting all these intermediaries. They're being bombarded with free eye checkup, free ear checkup, free this, no copays, no deduct. Come on. There's nothing is free in this world, man. There's nothing in this field free. You're paying for something. What I'm saying is, take that money from Medicare. You get a so-called health insurance personalized, HIP. so-called HIP. HDHP is nothing but a HIP. Get a high deductible health plan. Lower your premiums, put money aside, folks. I'll keep on harping till the day I die. This is my goal. I'm telling you, I'm passionate about healthcare. I'm passionate because coming from a poor country like India, I want you guys to be totally free from these shackles of healthcare. Right now, you're under shackles, man. Your insurance tells you this, your insurance tells you that, your government tells you this, your government. We don't want that, man. You can take care of yourself. Let's do it. Again, thanks for joining us. I love you guys. I salute you all with my whole heart. I continue to give you an advice which is good for you as a consumer. Follow me. I'll take you to the next level. Next level in personal responsibility, man. You can make money on your health. Yes, that's my goal. Thank you, guys. Thank you for listening. Subscribe, share, and touch that bell. Yes, touch that bell. Thank you. See you next time.